People who got this third vaccine dose, the Pfizer data, had higher levels of protective antibodies when given 8 to 9 months after the second shot. So break that down for us. How promising is this?
Well, look, we've seen a decline in the immunity offered by the vaccines over time, particularly in an older population. So when you look out at people who were vaccinated in December or January, what you see in the data right now, and this data is particularly coming out of Israel because they've been tracking very closely people who were vaccinated early, and they vaccinated their population very early. You see a decline in the antibody levels, and we think that that's partly why you're seeing more breakthrough infections in people. And so what we've seen from the data with the third booster is that you can not only restore the antibody levels to what you saw with the initial vaccine series, but you see antibody levels well in excess of that, so 5 to 10 times the antibody levels. And given that Delta is a more transmissible strain, that you have higher viral levels with the Delta variant, it could be that the virus is just overwhelming lower levels of antibodies. So as people's antibody levels decline, the virus is able to overwhelm lower levels of antibodies. So you initially get infected, and then you're dependent upon secondary immune cells like memory B cells and T cells to then fight off the infection. And that's why we're seeing more breakthrough infections with this Delta variant.
Right. What's your understanding of the administration's plan, then, to roll out those boosters? Are they moving fast enough?
Well, they've authorized it for people who are immunocompromised, and the authorization from CDC, or the recommendation from CDC, was actually quite broad. They enumerated certain conditions that people who have those disorders, those immune-related disorders, should qualify for a booster, but then they have broader language that people who are moderately, severely immunocompromised should qualify for a booster, and that scopes in a lot of people. I think the administration's on a timetable to offer boosters at some point in September to healthcare workers who were vaccinated in December and older individuals, probably people over the age of 60 or 65, who also were vaccinated back in December or January. I think the group that I would be most concerned about at this point are people in nursing homes or other congregate settings, because we know they were vaccinated very early. We know they're vulnerable because they have declining immune systems and they might not have gotten as robust a response from the vaccines in the first place. And we know that they're in settings where the virus can spread very easily. It's where we saw a lot of the death and disease from COVID during the first and second wave. So those settings I would be worried about. And they're harder to get vaccines into those settings because you have to consent the individuals. And in many cases, they don't have capacity to consent. So you have to track down family members. So it takes time. I'd be starting that process right now. I think the group that I'd be most worried about that we might be too late to offer boosters for, based on the data that we're seeing, are people who live in those settings, nursing home patients, people who live in long-term care facilities. But I think for the rest of the population, the administration is on a timetable to start offering these at some point in September. And final point, that's when they're going to have data from this so-called mix and match study out of NIH. So NIH is studying the ability to mix and match the vaccines, use them interchangeably. I think the administration wants to have that data set available because they know in the real world there's going to be inadvertent substitutions once you start offering boosters. So they want to have data to support that that's going to be okay to do.
So given everything you've just told us, can you paint us a picture for what you think late September, maybe October is going to look like, given the way in which maybe some of these cases have rolled over in the South, but maybe gaining steam in the North, and then with the booster equation added in?
Well, we certainly see indications that cases are peaking in the South. If you look at covidestim.org, which does an estimate of where the epidemic's heading, it shows in most states right now you have a slowing epidemic, and in some cases you have actually a decline in cases day over day. And you're going to start to see that in the data. I think you're going to start to see day over day in some of these outbreak states. And you're seeing it already, for example, in Arkansas, that the new cases on a daily basis are starting to decline. That doesn't mean the South is out of the woods by a long shot. The healthcare systems down there that are pressed right now are going to continue to get pressed even as cases decline because you're still accruing new hospitalizations. I think the big unknown is how big of a wave of infection the North is going to sustain. Is the Northeast somewhat impervious to the kind of infection wave that we saw in the South because of higher rates of vaccination and prior immunity from prior infection? Or are they still going to see a wave of infection as people go back to school and back to work and people head indoors as the fall comes on? I think that the New York region, the Northeast, the Michigan region is going to see rising infection. The question is how vast.
Dr. Gottlieb, your guidance is always appreciated. Good to see you tonight. Thank you. Dr.
Thanks
Scott Gottlieb.